Welcome back for another Les Kevin, more tech from UTECIT.com.
There you go.
Les, we are blessed today to have two of the industry's best experts when it comes to healthcare and insurance, aren't we?
That's right. And we're here to learn more about it today.
So we'd like to introduce Dr. Matt McCord from Health Solutions, and then one of our favorites, Jon Porta from Grace and Porta. If you need insurance benefits, there's nobody better to talk to and work with.
Thanks.
Than
those
guys.
What kind of insurance? Car insurance? Life?
They'll do it all.
They'll do it all? All right.
Employee benefits.
All right.
Yeah.
So, Jon, why don't you tell us about it?
Yeah. I'm Jon Porta, Grace and Porta. I've got actually three brothers. We work together, and we've been in the employee benefits space for probably 20 years now.
When you say you have three other brothers and you guys work together, you're actually doing all the work. They're the ones out playing, right?
That's why I'm here.
Yeah. Just wanted to be clear for the record.
That's exactly right.
I don't know if Trav's working out or, whatever. Dave's going to be playing golf later or what.
Well, we got the smartest one, right?
Yeah, exactly.
Okay.
So, we've been doing this about 20 years and been in the community for a long time. And, just excited to be here with you guys.
How'd it get started?
So my dad started it in 1979. He was a New York Life producer. And he met his partner, Ed Grace, in the same business, and they decided to start an agency together independently. And, it started out on the individual planning side, but as they met with business owners, they started doing the employee benefits for those owners because they're like, hey, can you help me with my Blue Cross plan and that kind of thing? And, over the years, as my brothers and I came in, we kind of gravitated towards that.
I get it. I love that story, and here's why. Number one, the family thing, right? Yeah. Carrying on generationally. But what I heard you say was that they didn't say, okay, I got an idea, I'm going to take it to market.
Yeah.
They went to market. They got feedback.
Yeah.
They got feedback from the client base, pivoted the business.
Yeah.
And moved from there. So that's a great learning point there.
Yeah. Yeah. No, I appreciate that. Yeah. My dad's always been kind of savvy, obviously, His main goal was always doing what's right for the client. And that, that's kind of carried through, with our business and my brothers and I is like, if you take care of the people, whether or not they work with you or not, if you're giving them good advice at some point in time, that's going to, come back to you.
That's awesome. And it's multi-generational.
Yeah. Yeah. We've got my nieces are working for us now. So we're now into the third generation.
Wow.
So yeah, it's been a fun ride. We're up over, I think, 23 employees and, we do benefits for about close to 300 clients now. So
good.
Yeah, neat facility too, right down there on Grand River Avenue, and I like what you guys did in the back with the garage doors that open up.
Yeah.
And, indoor outdoor offices. And just you guys been really involved in the community too, right?
Yeah.
I know the chambers, both Brighton, Heartland, and Howell all appreciate the work you guys do for everybody and give back in the community.
Well, yeah, we're all in this together. We want to see the community succeed and see the different organizations do well, because obviously as they do well, everybody does. So
great. And then we have another friend of ours, Dr. Matt McCord, who's everybody knows in the community here, does wonderful things, and one of the all-time great families, right, of Brighton.
Yeah.
Right?
Yeah. Thanks, Kevin. Yeah. It's good to be here with you guys. Yeah, Kevin, we're old neighbors, actually.
Old neighbors. Our daughters played soccer together, went through some battles, right?
Yeah, absolutely.
So, hey, tell us about Health Solutions.
Yeah, so Health Value Solutions, I really started this about a year and a half ago, 2 years ago, during COVID, so nobody knows about us right now. But I called another neighbor, Bert Herzog, and I said, hey, Bert, I'm thinking about this. This is kind of a financial issue that we're trying to solve here for employers. What are you thinking? Who should I talk to? And he said, you got to call the Portas and get in touch with them and meet them. You guys are perfect for each other. And he was right. And I'm grateful. Shout out to Bert Herzog on that referral, calling Travis. And we hit it off immediately.
Yeah.
So what we're doing, I'm a physician anesthesiologist. I'm in almost my fourth decade of healthcare delivery. I'm still actively an anesthesiologist, probably 2 to 3 days a week at least. But I wanted to help. I was very involved politically with the Affordable Care Act during the Affordable Care Act days with the healthcare industry. And most Americans on the commercial side enter healthcare through the health benefits that are purchased by their employer. So I thought, well, that is the area where we can be most impactful to help employers buy healthcare smarter and guide them on that purchase process and how they're using healthcare on an ongoing basis.
The one thing I'm real curious, before we get into the real meat and potatoes of this, you're the first guest to actually bring reading material. What do you got over there?
Yeah.
Are you studying or?
Yeah,
This guy reads so many books, I can't keep up with him.
Yeah, no, that's one of my things. I do read a ton. I'm a bit of a nerd in that way. I'm always reading a book. I never watch TV. My kids always tease me about that. Except, live sports, absolutely.
Yeah.
But that would probably be they always ask me about the Netflix password. I never know.
Okay.
I don't know what that is. But no, I have watched, of course I'm watching documentaries on Netflix. I read a lot. I got a book from a friend on remaking healthcare and this relocalizing health by a friend of mine, David Chase, who I met probably 10, 12 years ago. He's really a national thought leader on changing healthcare, and we can talk more about that in a minute.
Well, I mean, I knew you from your practice, right? And I think the first time I saw you outside of your practice doing this venture was we were at the golf outing for Work Skills, and here come the Porter brothers and Matt, and all dressed up in these Argyle, really cool golf sweaters that made me envious of how cool they were. And I'm asking you, what are you doing there? Because it was so out of it. But you're passionate about this. This isn't something that you're just doing. This is something that you're really passionate about. And you said that, hey, I wanted to change the way we deliver healthcare and work with a better product, right?
Oh yeah, absolutely. So I think what we've witnessed during COVID is we've seen all the kind of warts and scars, if you will, of the healthcare industry and how it's really very, very difficult. It's exceedingly expensive,
Right.
And it's really one of the number 2 or 3 costs for any employer is their health benefits purchase package, and you don't know how to use it as an employee. You don't know where to go to get the lowest cost care. You don't know where to get the highest quality care. So you're really flying blind with no guidance on quality or cost.
So I want to, because I've to use what Kevin's talking about, passion, because what I've heard Affordable Care Act, I've heard political involvement, and now addressing COVID. So this is not just something recent.
Yeah, this has really been, for me, it's been, almost a career in the making, or certainly in the past 10 to 15 years, I've been thinking about how to impact healthcare for the average American and the average American worker in particular. So yeah, I've been thinking about this for a while, and it took me a while to finally get the gumption to actually start trying to impact that. We now have 4 companies under management, I'm happy to say, and probably 600 workers maybe that we're helping manage their health benefits.
So, Kevin, what I'm hearing is I don't typically associate anesthesiology, and healthcare benefits. So that's a clear differentiator in the marketplace? Well, I'm going to assume.
Yeah, what I would say is, like, when Dr. Matt and I met, it was one of those intriguing ideas. I mean, as a broker, we bring out the renewal every year, and we bring the increase, and it's from the insurance side, and I've always known that obviously what drives premiums is the cost, the underlying costs, right? So when Matt and I started talking and going through this kind of process, it really obviously was light bulbs for me to have the opportunity to work with a physician to come into an employer group and help them manage their health benefits spend, because I've only been on the financial side. I haven't been on the clinical care.
So yeah, and when you were talking there, you said something that I take for granted, and that was, we come in with a premium increase.
Yeah.
Right. So it's like, I'm like every year I'm just thinking it's just it's going to go up.
Right.
But what I hear is that you're managing the premium increase. Now, is the goal then to flatline it, deliver better care? Is it to drive it down?
Yeah. I mean, when employers are looking at their insurance, they're looking at like refinancing what's going on. Right. And we can, you can go around and refinance, but until you get to the underlying costs of care, where people are going to get care, what kind of care they're getting, what kind of medications are they getting, are there better ways to buy care? That's the kind of stuff that Matt and I are digging into to help employers, because that's what's driving the rate increases for everybody.
So that message is unique.
Yeah.
Yeah, so 80% of the cost of your premiums for any employer is because of the clinical care part. So we're attacking and we're helping you lean manage that problem. And until now, most employers didn't have any, who would they talk to?
Right.
They didn't have much capability in starting to lean manage that number 2 or number 3 cost on their ledger. For example, a small business within 100 employees is spending over $1 million a year on health benefits.
Wow.
And a significant portion of their workforce is avoiding care entirely because they don't want any out-of-pocket costs.
Yep.
So we help manage that problem and make care not only more affordable, but we create a free door where the employee can go through the free door with no out-of-pocket costs and make sure that they get the care that they should be receiving. And that's with a higher quality, better value care provider. And we prepay that through their benefits plan.
Well, isn't that what's kind of wrong with the system? You said Affordable Care Act. And Affordable Care Act, really, there's no incentive for the insurance companies to contain costs as they're with under Affordable Care
It was
Act.
insurance reform is what the Affordable Care Act was.
Yeah.
And really it just changed how insurance company could do their rating. But it was, you brought this stat up before, but as the Affordable Care Act was passed, you see the stock prices of all these insurance companies and the direction they've gone. They've gained more market share. Now they have subsidies to help offset their increases. So, they've been insulated.
But yeah, because there's no reason for them to drive down costs, because, they're built on their increases to get to go on what their costs are each year. Right. So it doesn't.
Well, actually, yeah, the Affordable Care Act, there's a rule, there is part of the Affordable Care Act called the medical loss ratio that required these insurance carriers to not to return or spend 80 to 85% of their premium costs have to be spent on healthcare. And so, in other words, they keep 15% max. So because of that funny rule and the unintended consequences, they want more churn, they want more transactional care delivery, because that means that 15% number is bigger.
Yep, bigger number, bigger profit. Right.
So, and by the way, most benefits sales agents and agencies.
Easy now.
Oh, I know.
Yeah, I'm sitting here thinking about this.
Yeah, sorry. Forgive me.
That's okay. Go ahead.
Don't hit me.
Well, I get to come at you next, so go ahead.
Yeah, you're right. Yeah. So yeah, one of the funny arrangements is that most benefit sales agents in the marketplace, while they come across to the employers as they're this client privilege and they're working for the employer, they're actually getting paid by the carrier.
Right.
And they're getting paid a percentage of premium costs. So both the carrier and the agent in most circumstances benefit from increases in premium costs, which average about 9 to 15% a year, which is what you said at the beginning of this discussion.
So yeah, you can see the conflict here. And so far, I haven't seen you guys duke it out. But
We're going to try.
Well, wait a second. I'm the 20%. He's the 80%. He's on the physician
That's
side,
true.
Right?
Yeah.
Yeah, but you got him
I'm the
an arm
80%
length.
problem.
So we go back there. So we got the insurance companies.
Yeah.
We got the bad agents that try to manipulate this, and then for the employees and an individual user, I'm like you said earlier, I'm not going in because I don't want to pay out of pocket. So we don't fix things on the front end. We don't do any of the preventative maintenance on the front end, which then leads to bigger problems on the back end for everybody, right?
Yeah. Absolutely. There's no preventative care happening. So, that's about 35% of your workforce, if you look at most companies, are not getting care at all.
Yeah.
Because they do not want to pay any more out-of-pocket costs. And by the way, the out-of-pocket costs, co-pays and deductibles and all that, have increased about 215% in the past 10 years. Terrible. And you're talking about an employee that's maybe making, $50 to $60,000 a year. They've got enough things to pay for their family, and many times they don't even have $1,000 in the bank. Mm-hmm. What is that bank rate survey said? Like close to 60% of Americans don't have $1,000 in the bank. How are they going to afford a $3,000 deductible if they need a knee scope or something like that, right? So they're really not getting. They're functionally uninsured, even though, again, their company is paying millions of dollars for premiums.
And then the other part of it is just the darn complexity of it. As a consumer trying to manage your own healthcare.
Well, yeah. Where do you go to get recommendations? Like Facebook, right?
Right.
You're like, hey, who knows a good back doctor? I've seen that.
The Facebook, the neighborhood app.
Right.
That's another one.
Yeah.
Right.
Right. And you really are flying blind. There's very little. You have no representation when you're out there trying to consume care.
Well, we were just talking to, we had heard this stat, right? So, I think it's something like 25% of folks that have a cancer diagnosis are misdiagnosed. They've been diagnosed with cancer and they don't have cancer. Wow. And then they start down a path of chemotherapy and all the other stuff that happens. And I had heard that stat, and then it came to a realization when I was sitting with a client, and I had shared it, and they said, I'm that person or my wife is that person. She was diagnosed with cancer, and they were about to start treatment, and a friend said, you need to get a second opinion. Mm-hmm. Luckily, they got a second opinion and found out that she didn't even have cancer. And I can't imagine what that treatment would have done, Well,
what's the financial impact on an individual?
Yeah. And, the number one reason for personal bankruptcy in the United States is healthcare.
Is it?
And it's about 67% of personal bankruptcies are because of healthcare and health-related problems.
Yeah.
And 70% of those folks have health insurance. Mm-hmm. So you think, well, shouldn't that be protecting me for these problems? Certainly, part of that's related to the fact that if you have a significant diagnosis, you may not be able to work. Mm-hmm. Right. So that's part of it. But a big part of it, you'd think this would protect you, but actually no.
Right. It does the opposite.
Yeah. Right. Well, it just, there's a lot of things we can do to improve care, and it isn't not as complex as they would lead you to believe. And we basically are taking strategies utilized by the largest companies in America that have a lot of resources to spend on healthcare and manage that problem, and move in smaller companies to use those same strategies and lower their healthcare spend that way.
So when you say smaller company, what do you mean? Is it a 10 employee, 100 employee, 500?
Ideally it's in that 100 range or above. I mean, there are opportunities potentially below 100, but the main key factor is getting a client to go to self-insurance, so self-funded health plan. And you need to have a decent amount of premium in order to kind of make that jump.
Got it.
So generally we're seeing it in that 100 range and above.
Mm. So that was what I was going to ask. I mean, Blue Cross Blue Shield, it's a name, right? Everybody recognizes, and we just assume they're the best, right, in Michigan because they're the biggest. Are you saying that not to use them? Are we saying to work with them? How does that play a role?
Yeah, so most of the time, what we're talking about is actually moving away from Blue Cross Blue Shield or any of the other carriers that are out there, and go to an independent TPA, which is a third party administrator, and they would be the ones that would help pay claims. And the reason we do that is because you have more opportunity to kind of steer traffic and do some different things along the pharmacy benefit management. With the carriers, it's kind of like everything's kind of bundled together, and obviously, as we know, some of the strategies that they have not been able to save money for the employer. So we've looked at independent TPAs to kind of move in that direction.
Yeah, I think, what Blue Cross will always be there. They're a great company, great industry. They've been very successful.
Yeah.
Given the structure of the industry as it exists right now. They too want to change. Actually, Jim Grant, who's one of the chief medical officers, I believe that's his title, at Blue Cross Blue Shield of Michigan, great guy, friend of mine. He had an article in Crane's Detroit Business this week about moving from volume to value, and that's exactly what we're trying to do. And so they're going to absolutely play a role, and they may become the best TPA around,
They
right?
could, yeah.
And a TPA basically is the inner workings, the PayPal, if you will, for that health benefit card you're carrying in your hand. And there are a lot of companies that do that sort of service and provide that sort of service for companies when they get their health benefits. So we're basically breaking it all down. We're breaking down how you're buying pharmacy benefits, and there are pharmacy benefits companies out there that do a really good job, and that are very skinny. They don't take a lot off the top, and they give you a very good deal, and they help you buy pharmacy or medications. That's about 22 to 25% of a company's spend. That 80% of the spend, about 22% of that is the pharmacy part.
I think
So that's where we can make the biggest impact initially. When we move to self-insurance, that gives us a lot more flexibility on benefit plan design, and then we could design it that makes the most sense for that employer with their employees, with their geography, where they're at, which network they may want to be part of or not. And these sorts of things we can actually build within the benefits plan.
So just to give you an example, right? So if we were to look at a different pharmacy benefit manager, as Dr. Matt was describing, there might be a copay assistance program that's out there where the manufacturer might have a help with a copay. So these PBMs are creative enough to where they increase the copay on that particular drug in order to take advantage of that copay card that's out there, which in turn saves the employer money, right? And they can be upwards of $1,000 in a copay assistance.
So, all right, what are they doing today? Right now, if the employer is unaware, right, that there's this benefit, who's getting that money now?
I mean, the manufacturers are keeping that money to themselves, right?
So that's an education, awareness, and program.
Yeah. And
Another differentiator you're offering.
Yeah, and some companies, some PBMs will take advantage of buying drugs over internationally. So you think of Canada and some other countries that they buy some of these medications because they're a third of the cost of what we pay here in the United States. And so an employer may put a program like that in, and obviously, if you've got a drug that's $6,000 that you can get for $2,000, you might waive a copay or incentivize that type of purchasing.
It's insane.
Yeah.
That's monthly. I mean,
right.
Yeah.
Oh, wow.
So what John's describing is really what we've called active benefits management.
Yeah.
That's how we're different. We're not really just a group benefits sales company. You don't see us once a year before renewal. 2 weeks before renewal. Sorry, it's 9 to 15% increase. We really get in the weeds because we know the weeds.
Yeah.
And so we're down there digging and we're saying, okay, this is where you can really benefit. And we instruct the employees, say, look, you don't have to spend that much for your medications. We've got a solution for you. We can build that in the plan. I don't know if either of you guys have used GoodRx, for example.
I do, yeah.
Okay. So GoodRx is kind of, they're actually getting rid of that. There's a spread that's part of drug purchasing. And if you use GoodRx, you can go, well, geez, this drug's like, 50% less at Kroger Pharmacy versus CVS. I'll see you later. We highly recommend actually using something like that. The catch with that is GoodRx is kind of outside of the space of your benefits plan. So you're not getting the credit towards your out-of-pocket max. Exactly.
Like so you got to be a little careful with that, but we like to use it as a guide just to illustrate, like, hey, look up your drugs on GoodRx and look at what you're paying when you walk into the pharmacy. That'll tell you.
Yeah.
Give you some idea.
Yeah.
There's a lot to it.
Yeah, I mean, Mark Cuban obviously started his own PBM for this exact reason. I mean, he wanted to go after this industry, and we'll see how successful he is. I mean, it's kind of interesting. He's like, I could have taken so much profit out of this business, but I don't want to. He's like, I want to help employees. So.
But the big thing working with Health Value Solutions is that we're not compromising our health care. We're getting actually better health care because we're managing the cost of it, and you're steering us and working the right way.
So
I can keep most of my doctors. I can get good.
So how we usually we try to structure it is we'd move you from fully insured to level funded. We take some baby steps. It's a 2 to 3 year process, and move you to the higher quality providers, the higher quality places. If there's a question about a diagnosis of cancer, for example, we'd get a second opinion and some other things like that. Because we're experts both in benefit plan design and purchasing, as well as healthcare delivery.
Okay.
Right. So it's not just me as a physician. We have nurses as well. We are guiding the employees to a better plan. The other important difference is we get paid a fixed management fee by the employer for this active benefits management structure. So we build that also into the plan. We're not getting paid more if you spend more on healthcare.
Yeah, it's a flat fee.
So it's a flat fee. We could talk about shared savings incentives. We could talk about employee satisfaction. I think that should be part of a benefit plan.
In the era of the Great Resignation, right, employee satisfaction is probably more critical today than it was even a year ago. Retainment of talent.
Yeah, so there are other people in the industry out there in the industry that are doing this. Not so many here in Michigan, but there's probably at least 200 to 250 agencies that are out there in America that are doing a lot of what I'm describing.
Yeah, the guy that wrote the book is the one that started the group called Health Rosetta.
Exactly. Dave Chase started Health Rosetta. This is Relocalizing Health. This is his most recent book. He writes prolifically, and he talks about how to relocalize healthcare and healthcare delivery. But to give you an example, in Idaho, they, with some employers out there, some friends of ours, associates that I know, it created did some direct contracting with a local best hospital for labor and delivery. So they actually designed in their benefit plans, if you went to that facility to deliver your baby, you got free diapers and formula for 2 years.
Yeah, and no cost.
At no cost, all prepaid. But this is how much money is being spent on healthcare.
Yeah.
You could, within that benefit plan design, you can actually make it very generous with your employer and say, look, we can make this really interesting for you and your employees. And by the way,
I never heard of anything like that.
Yeah.
But that's fantastic.
Yeah.
Yeah. And that's really how, that's guiding the employees to make the right decision, go to the right place, because they have no knowledge. They have no way to know that. This is the better, safer place to deliver a baby, for example. But we know this information, and we can guide folks to the right.
Well, and we have quality data too. So we get to see how many, particular procedures a physician does. We know the quality of their outcomes. There's a database that we subscribe to for that. So I mean, when you talk about directing traffic, tell them about the ambulatory surgical centers, the price difference on a hip surgery or knee surgery.
Yeah, there's great variation in costs. Like for a hip replacement or a knee replacement. In some facilities within a 60-mile radius of here, or an hour's drive, the fluctuation can be anywhere from $60,000 for that to 15 to 20.
Yeah.
And, that whole quality issue is really obscured in the marketplace. There's a great Johns Hopkins study that came out a couple of years ago that, medical error and complications is a third leading cause of death in the United States.
I had no idea.
It's a big problem, and it's actually, I just tweeted this and I put this out on LinkedIn, but since COVID, it's gotten much worse, and we're really not reporting how much worse it is. But because of staffing shortages within the delivery space, all that, the complication rates have skyrocketed. And when I'm saying complication, I'm talking about like acquired infections in the
Right.
hospital, for example, and complications.
With events and, with COVID, eventing was...
Yeah.
Well, what's interesting, you mentioned like the cost and quality. Just because it's cheaper doesn't mean you're getting worse
I was going to ask
right?
you that because, there's always would you rather drive
It's actually inverse because
Really?
they're so good at what they do, these ambulatory surgical centers.
They're more efficient.
They're more efficient. They can get more people through, and they do it well. Without complications, without any readmissions and things like that. So they got it down. And
so it's not like the what was it? I think it was Tampa. Wasn't it the hospital where the guy they amputated the wrong leg?
oh
Yes.
gosh, yeah.
And then they started Xing, and then the one that was, and if a year or two later they got confused, and does the X mean we take or we don't? And then they made the mistake again.
Oh,
I mean,
yeah.
I hear those stories, but the other ones,
Right.
It's
Well,
fascinating.
at the end of the day, we're on an unsustainable path the way we're doing things right now with healthcare, right?
Yeah.
As it relates to employers and such.
Yeah.
And so we need to be investigating, health value solutions, organizations like that, working with Grace and Porta to make sure that we're managing those costs, finding new ways to deliver it, right?
Yeah.
And as employees, we need to own it too, right? We need to do some work ourselves and look at it and research our costs.
Yeah. And that's kind of what we, some of the things we're doing as far as like waiving deductible, right? If someone needs a procedure, call up our nurse concierge. They'll give you 2 or 3 options, and, a couple of them are going to be a no deductible type program. And then if they want to go to the place they've already been scheduled at, they can, but just know they got to pay that higher deductible. So we're starting to bring consumerism into that, equation for the employees.
Good.
It's a big education for me today.
Yeah.
Very big.
Yeah.
Well, this is a valuable service, and thank you for your work. What else? What did we not ask you today that we should have asked you? What do we need to know out there? Anybody listening to this about the healthcare?
Oh boy.
I've got one. I just came up from an earlier conversation. Most of the people who are out buying for companies, the benefits is what role in the company.
Oh yeah, no, that's a good point. So, I think that because of the cost of this program, I think that owners, CEOs, CFOs need to get more involved in their decision making on the healthcare spend, because it is a huge expense. And I think what Matt and I are talking about, I think one thing to keep in mind, this isn't for everybody, because some employers just don't want to get into the weeds. They're okay paying a premium and staying out of it. But, for those that have the mindset that they're going to go into this and they're going to play more of an active role in managing their healthcare spend, I think the CFOs, CEOs, owners need to get involved in that decision-making process for sure.
Yeah. In our experience thus far is, we can save 10, 20, 30% pretty much from the start, which is a significant 10, 20, 30% of a big number is a big number.
Right.
And so now you can have more resources to make sure you recruit and retain your people and use that money for your company and help your company grow or certainly maintain its workforce. So yeah, we can quite easily do that, just taking some of these initial steps. If we go all the way down the path of what Dave Chase and other Health Rosetta folks or U-Powered Benefits folks and others in the industry are talking about, you could save probably close to 50%.
That's incredible.
Of a really big spend.
Better care.
With a better service, a better outcome, and more satisfied employees, because it's easier and it's free.
Yeah, they call it the Health Rosetta dividend. So it's like whatever you save that year, you can reinvest into the plan. I mean, Rosen Hotels down in Florida has taken that money and actually sponsored a whole community. They're paying for college for kids coming through a community down in Florida with the savings that
because it's a given expense they already had.
Yeah.
So rebudgeting.
Yeah.
So what I'm curious about from the business side of the equation, this message is different. You're definitely a unique player in the marketplace. What is, I just get a sense that the message sounds really appealing. What is the challenge that is being faced in the marketplace delivering the message?
Yeah, I think the challenge.
Or am I just so ignorant of it that there isn't nothing and everything's roses and?
There's definitely a challenge.
Yeah.
I mean, moving to a self-funded program is not, it's not going to work out for everyone. When you think of like high turnover businesses, those kinds of things, it's a little bit more difficult to get what we call reinsurance or stop loss to protect a client. So that can be a bit of a challenge, placing stop loss to even take that first step into getting to the managed care side. I would say the other challenge is a little bit of disruption, right? I mean, as you put these programs in place, when you think of even changing pharmacy benefit managers, there's a process of getting a medication. It might take a little bit longer. I'm not saying like, weeks, but it could take a few more days to get a script filled because they're going through a process to try to maximize savings. And that's why I say the employer's got to be on board with this, because at the end of and education is a big thing, right? We've got to educate the employees on, hey, there's a better way to do this. And, we get to the end of the year and we see some savings. I mean, this is going to come back to the employees through better benefit design and things like that. So, the one thing that we've got to do a good job of is educating and communicating the savings to the group over time. And a lot of brokers that are in this Health Rosetta, group, they've been doing a great job communicating to employees, and you get buy-in, right?
So do you face inertia? In other words, we've been doing it this way.
That's the main. Our main competition is status quo or do nothing, right?
Yeah.
And nobody got fired for hiring Blue Cross Blue Shield, right?
Right.
I mean, so that's the status quo is a huge part of that. And now during COVID and remote work, you can't cold call anybody. Nobody's there to answer the phone, right?
Right.
So I meant it when I said nobody knows we're here. Because
Exactly.
they're not answering the phone. And then you start talking health benefits, and it's like they get glassy eyed.
Right.
Well, and I think too, the broker community, I mean, I can be guilty of this too, right? It's the easy button to sell Blue Cross. And to Matt's point, you put the plan in place. There's really not a lot of management from the insurance side. I mean, we're doing other things as it relates to, HRIS systems and helping with compliance and things like that. But not to the degree of what he and I are getting into. And I mean,
I love that term disruptor. I
Yeah.
mean, this is truly disruptive, because I think what you're saying is it'd be pretty damn easy to take a 9 to 15% increase in revenue every year.
Yeah.
And, just by building and maintaining a current customer base, that's the simple route.
Yeah.
And we're hoping our timing is good, because during the beginning of this last year, 21, rather, the Consolidation Appropriation Act, which included all this funding for COVID relief. I don't know how this language got in there, but they had all this language about the how these health plans are structured, and calls for greater transparency, very similar to the language that was part of the Retirement or Pension Protection Act of 2006, which called for greater fiduciary disclosure, which brought on the whole industry of Vanguard and others on pension plans, and how you can invest more clearly with more disclosure there. They're bringing that to health benefits.
Wow.
So that we think totally, it favors us. It's going right in our direction, which is, again, what we'd rather charge a monthly management fee to help employers lower that spend. And we'd like to be, the buyer's agent for these benefits, not the seller's agent, right? So
that's interesting.
So this is where we think our timing's good, other than the COVID pandemic. We think we'll be, and thanks for you guys featuring us today to kind of get the word out a little bit and instruct that there is relief.
Well, real quick on that act that was passed, it also required the hospitals to publish their pricing. So what's really interesting is we just subscribed to there's an aggregator out there where the guy basically came up with a website. He's going out and pulling all of the hospital data, and then he's making it searchable on his website. So I could pull up each hospital, I can look up a procedure code, and I can see what they charge each insurance company.
Wow.
So whatever card I walk in the door with is what I get to see what I have to pay for that procedure. And It's kind of shocking how different.
Is that ever going to hit the public, or is that just in your industry?
It's public, and there are some. There's one that I can't remember the name of it off the top of my head that you can actually go on right now. And
HealthCare Blue Book kind of tries to do that.
They try to do that, but yeah, I mean we pay for a subscription for this, but we can bring that to a.
Yeah, I'm just imagining if it gets out in the public, hey, I need a combo number 2. Supersize it.
Yeah, well, I'll just put in a plug shamelessly. If you're getting a colonoscopy, get it with anesthesia. I'm just gonna say it's bad enough as it is, but you want it with anesthesia.
Well, on that note,
Yes.
I have a college buddy, Rich Dazer, and always said that if you drink more bourbon, you'll be healthy and you won't need health insurance.
Right.
So we're looking for our bourbon sponsor out here for Less Tech. Less Kevin, more Tech.
Yeah.
And what's your favorite flavor, John?
Jefferson Ocean.
Jefferson Ocean. You're my guy. How about you, Dr. McCord?
Eagle Rare is
Eagle
probably
Rare.
my most favorite right now.
Well, to that, thanks for having you guys in.
Appreciate it.
Appreciate it.
Yeah.
Cheers.
Cheers,
Thanks, guys.
Thank you.